Dr. Gunawardene, a cardiac electrophysiologist from Germany. Currently just moved to Frankfurt, which is a high-volume EP center, and we're experienced there treating any arrhythmia, complex, simple, whatever you want to call it. I believe that there are several benefits of implementing the technology into 3D mapping. One of them is the physician's standpoint that I'm taking as a female cardiac electrophysiologist, because for me it is important to reduce fluoroscopy times. And I think when you can integrate a mapping catheter and an ablation catheter or anything into a 3D system, then you reduce your fluoroscopy times. So this is the standpoint I'm taking, and I can already see this happening with generic 3D mapping systems, but also with the Opal system as I've used it so far. The other aspect is obviously my patient that I care for, and what does it improve? I get more knowledge and information out of this. By mapping the left atrium in the first procedure, even if I'm only going to apply a pulmonary vein isolation in this patient and then leave it like this, I will know much more about the atrium of my patient, the voltage information. I will know, is there atrial cardiomyopathy, where is the low voltage located? So when my patient comes back with a recurrence maybe, I do know more about the strategy for the next procedure that I'm going to choose. Also, I think that I can put in more precision into my lesions that I'm going to apply with PFA, because I will see much better how coaxial I am. And you know that we have the problem about stunning. So once I apply PFA, nothing is really guiding my next ablation lesions that I'm going to put down. So with this technology, I can see where I haven't been, and I can start ablating there, even if there's no signal left due to the myocardial stunning. And I think that's the great advantage, and I hope that this is going to increase the PVI durability of our patients. I think it's important to do the best job we can by integrating a catheter into a mapping system. So obviously up till now, we only used impedance tracking, which was just giving us an impression of where a circular shape of the catheter might be. But now we actually see every spline, we see every electrode from the spline, it's color-coded, it's much more intuitive to understand what is happening, and we can really work on the position now. And we get real feedback on what we're doing, where our catheter is, and how we want to ablate our patient now. I think the efficacy needs to be evaded, obviously, because we don't know any outcome data yet. But yes, it does have procedural benefits, because I do have a distinct visualization of the catheter. I see every spline, I see it color-coded, I see the different shapes in the anatomy, and it helps me navigating this catheter in the atrium, and especially how the coaxiality to the vein is. I can much easier position the catheter where I want it to be because I have visual feedback on it. And the other thing that is really nice, I also use it to know where the other veins are, because I am mapping the veins with that catheter, obviously, and I can use it to advance from the superior vein maybe to the inferior vein easily, because I can use that catheter and move it in the 3D map. I think the e-field that is provided by the catheter really helps us to understand where the electrical field is going to be. We have to be careful with the use of the text, because they're not going to show us where the actual ablation lesion is. It's just an estimate about the field and where we can project maybe where the lesion is going to be. So I think it is really helpful, especially again, and this is what I pointed out already, about the point about myocardial stunning. With the stunned tissue, nothing really guides our ablation. But now that we know where we already applied the electrical field to and where we need to go next and how much overlap we need here, and that's what I really like about the color coding, because you see, I've been there once, I've been there twice, I have to go there again. You can stack your lesion, you can see it, and the denser the color gets, the more you know you did a great job on doing it. So this is very helpful. I think what you really have to consider is that when you're pushing out the anatomy too much, that the the field will not be projected the way you really want it to. So be really careful with your mapper in which position of the catheter you want to take the anatomy and about the pushing of the geometry. But once you figured this out, it is really helpful to see, and you can use it easily to guide your ablation target.